Yo, what's up? So we've got Sharon Sauer here. She is a certified myofascial trigger point therapist. She's one of the pioneers in the field. She's been treating patients since the early 80s.
Yes.
Yeah. So we want to go through kind of a 10-part series of what's the most usual suspect for creating pain. Behind us here, you can't really see on the camera, we've got these cool charts that she's developed where you can look for a number, like number 19. If you have pain in the lower abdominal, you go there, and then there's a list of muscles and a list of nerves that the pain typically comes from. And then she's developed a whole system on how to treat it. So
And the most likely one is the first one.
yeah, the most likely suspect's the first one, so you kind of treat in order. So what we're going through today is we're going to go for low back pain.
Right.
And what's the most usual suspect?
The iliopsoas.
So psoas is the most usual suspect. That's on this chart, which is cool. And we're just going to go through how you would treat iliopsoas. So walk me through it.
All right. So you might check to see what level we could check the muscle to see its range of motion, and then we could go ahead and treat it. So let's go ahead and take a look at you laying on the floor.
Yep.
Okay, so then we're looking, so what you want to do is look for a short muscle. So let's go ahead and bend your knee. And so we're looking, if we're seeing, can we get this knee close to that shoulder? So how far can we get it? So the closer we get it, the better.
There's some distance there.
So let's try it.
Yep.
Okay, let's have you lay on your tummy.
Yep.
And let's put that ball over here. So let's sideways. And let's find the belly button. Then we're going to put the ball right there, and then you're going to lean on it. That's where the psoas starts.
Yep.
And you're going to look for a painful spot. If it's not painful, you could come off of it.
Found it.
Oh, we found it.
And so what's the
So
protocol?
they're going to go ahead, breathe and relax.
How many breaths?
At least 2 breaths.
Okay.
And then after 2 breaths, you kind of lift up a little bit to let the blood supply in.
Yep.
So we're squeezing out the painful chemicals, and then you could do it again. Leaning on it again.
So you can do a couple sets of this.
Yeah, a couple sets, and then 2 breaths, and then come off of it again. Then we're going to move it down. So then take it a little bit lower. Come right here.
So you're going to move down in about 2 inches?
Yes, and you keep coming down.
Kind of in a straight line off
Yes.
of the side
Well,
of the belly button?
it's a little slightly a diagonal towards the
Towards
femur,
the groin. Okay.
where the psoas attaches.
So 2 breaths in each spot. Come off of it to let some blood flow through it.
That's right.
Go back in there.
And push on it a little
Breathe
bit.
it out.
Now you're pushing out those sensitizing chemicals that cause the muscle to be compressed, tight, and painful.
And then I'm going to move it down closer to the groin.
Keep coming.
So do I want to go past the pubic bone or just above it?
We're going to come a little further. So you're
A little
going to be
below it.
So you're going to go to the inguinal ligament and then go a little bit lower.
Yeah. Oh, that's there.
We found that spot.
Yeah.
So this is a great tool. It spreads the tissue, and then it pushes the painful chemicals out, and it lets the blood supply in. It's great.
And so you would do this on both sides if you
Yes.
were actually treating.
Well, you could.
Correct.
You generally would treat both sides, but you could treat the side that doesn't pass the range of motion test.
Yeah, totally. And so once we do that, you're going to spend a total of what, 2-3 minutes kind of working your way down there?
Yeah, that's it.
And then you would retest.
That's correct.
Cool.
And
And
see if we did good.
and the retest would be the same
Okay,
deal.
that's the same thing. So you're going to bring you measure from the patella, and you bring it towards the opposite shoulder, and we're seeing, did we get a little
Did
better?
it go a little bit further? So you would measure that before, measure that after.
Yeah.
And with your system, if that didn't work, you'd just go to the next muscle, the next item below.
And there's an underlying perpetuating factor. You could have a nerve compression and the nerves that go to the psoas.
Yeah.
And I put that on the poster.
And that's all on the poster, but if you are working with a client or you're somebody with low back pain, this is an easy entry into trying to self-treat.
It's great.
Give it a shot.